would do this and the chart and do it over and over and over, but I'm drawing this mostly because it helps you. I'm a table person. So if you're a table person or a bullet point person, make your bullet points to help you walk through it. So I can make some bullet points for you to help you understand this better. But I just drew that for you of what's going on. So here are my antibiotics. I'd write down the whole chart of my antibiotics 15 times until I had it memorized, maybe 10 times, maybe 30 times. It depends on your own memorizing abilities. You know, for me, it takes me probably more than most people, but you know, I have to put in the time, I know that. So here are the beta-lactams. So this is what's going on with the beta-lactams. You have the bacteria that normally have this bacterial transpeptidase enzyme that lays down peptidoglycan. The beta-lactams will block that enzyme so that it can't lay down any new peptidoglycan. So anytime it goes through binary fission, all of its offspring are going to die. Except if one of its offspring had a mutation of a beta-lactamase enzyme, where that enzyme, it now chelates, or it pulls that beta-lactam out of the way so that the also sanitation is another word for that, mostly safe. I put sterilization, no endos for myself, no endospores. I just made myself a little quick note. Here I put yes endos, no vegetative cells. So I put yes endo, no veg, so that for myself I know what that means. So no vegetative cells, that endospores can still survive in this disinfection bracket. Sterilization is no endos, but remember the reason why we can't use the most stringent every time is because they can be toxic. Yeah?
So with decontamination, right, you're not going to kill vegetative cells?
Yeah, so decontamination, so everything doesn't fit perfectly into the bracket. So what soaps do, for example, is like soaps can remove the glycocalyx, like the sticky capsule or biofilm from a substance and move it away. Where if you talked about like a detergent, it might be able to break up the outer. So it depends on what one you're talking about. We're trying to fit everything into these three brackets. So without thinking too crazy about it, what they're gonna ask you when you move on to clinical medicine is they're gonna say, we use a disinfectant for this, we use a decontamination technique for this, and we use sterilization on these instruments. So that's how they'll name it, so.
So as far as like aseptic and antiseptic?
Yeah, that just means aseptic is on something that's not living, antiseptic is what you use for a term that's living. So you'd use those terms differently. You'd use like, use an antiseptic. Well, an antiseptic, it could be really any of these, not really that, because you can't really sterilize skin, but you could say, oh, we're gonna use an antiseptic. Antiseptic just means that we're trying to kill organisms on a human being versus on a fomite. Does that make sense?
So your fomites are your aseptic techniques?
Yeah, so fomites, it's getting rid of, so aseptic is getting rid of organisms on materials,
and
on
you
fomites.
can use sterilization for that?
Yeah, you can use sterilization
So you
for that.
can use any one of those on an aseptic, and then antiseptic is just your most safe ones?
Yeah,
Okay.
yeah, safety, yeah. Does that kind of make sense?
Yes,
Okay.
yes.
Okay, they're all terms that are kind of used interchangeably a little bit, and probably people don't use the terms correctly most of the time, but that's just like it's just a good introduction for when you start. Well, they will ask you that on like T's and NCLEX. So mostly what they'll ask you is like the definition. So like knowing the definition of like, this doesn't get rid of endospores, this does get rid of endospores. Decontamination we use because it's mostly safe. Antiseptic you can do on people, aseptic you can't.
Yeah, okay.
Okay, because you can't have asepsis. The definition of that would be nothing at all, which you can't really even achieve that on human beings. Does that make sense? Okay. Yeah, go ahead, Dr. Duffy.
Can you just touch on the part like antibiotic resistance and antibiotic targets, like for like
Oh, yes.
bypass and like
Yes.
a lot of we know benefits. Do they know
Yep.
that?
Okay.
Can I switch a whiteboard?
Oh yes, please do. Yeah, 100%. 100%. Where did we talk about that? We talked about.
There's a good one on slide number, towards the end.
Towards that.
Maybe 90% through.
That one?
Yeah. So like the antibiotic targets make a lot of sense. So they target like the cell wall, they target the DNA, they inhibit proteins. So like what about the resistance slide?
So what that means, so these are techniques, not, I have to be careful of my wording here. So what happens is the bacteria will undergo a mutation, so an antibiotic. So for example, we have evolved, I don't wanna really use us as an example because we mutate so slowly, where bacteria mutate really rapidly.
But they
So,
reproduce a lot, right?
yes, because they, undergo so many
Like
and so
millions
much
of times.
replication, yeah. So one accident, so let me just keep it simple. So if there was a mutation in the DNA that created a protein on the surface of the bacterial cell that acted as a pump that will pump out antibiotics. So we could just use this little beta-lactam as an example, but it will, if it pumped out, then that's called an efflux pump.
And who created that? Or?
So this is the bacteria. So now it's happy because now there's a mutation in its genome or on its plasmid, probably more likely the plasmid, that created this efflux pump, that this efflux pump now can pump out any of the antibiotics.
That makes sense.
Yeah.
Can we talk about immunity and bypass? That was the one that was hard for me to.
Yeah, so
my head around.
almost what it is like, I'm trying to think of an analogy. If I said, like, come over here, like.
It's the distraction one?
It's like a distraction.
Okay.
Yes, so it's like, for example, if, like, what is one type of antibiotic that attacks a ribosome? So like an aminoglycoside. So here's an aminoglycoside structure, and this aminoglycoside is gonna go attack this ribosome. Well, this bacteria, what it did was make a ribosome-like thing. Now it's going to attack this ribosome-like protein. Now the ribosomes can go do their thing.
So it's just a distraction.
Distraction, yeah. So does that make sense?
And that was the immunity bypass.
Uh-huh, yeah.
Those are all mutations. Most part.
They all happen from mutations accidentally. And sometimes they can be passed, it can be from a mutation and it's on a plasmid, then it can be conjugated into another bacteria. So then that bacteria, they're all in that area, they can all have the same protein. Okay. And then target modification, so what's one of the antibiotics that target folate synthesis? Sulfonamides. Okay, so here's the sulfonamide structure, which I have no idea what it is. But, so, the sulfonamide targets, what does it target again? Folate synthesis. So folate synthesis, so here's folate, here's an enzyme that's creating folate, or folic acid, so it's creating this folate. So here, the sulfonamide will come in and attack this enzyme, but what it's gonna do is change the enzyme structure so now it looks like something different. So now it's going to pretend to be something different. So now maybe this sulfonamide binds over here. I'm trying to say this in an easy way, sometimes I get too crazy. Okay, so here the sulfonamide binds to this enzyme that makes folate. But what it's gonna do is change that structure so now the enzyme looks different and now the sulfonamide can't bind to that enzyme anymore. So it changed the target. Yeah? Okay, And then our last one was inactivating enzymes, and this is our classic beta-lactam example, where you have your bacteria, and you have, name the 4 beta-lactams.
The cephalosporins, penicillins, carbapenems, and the glycopeptides.
I have no idea how to spell cephalosporin. Can you spell it?
Yes.
Sure.
Yeah, am I right?
Yeah.
Ooh, nice.
And
Lucky.
glycopeptides.
Glycopeptides. Okay. So these all have that beta-lactam ring. I just draw other stuff over here because it's a big structure. It just has this ring is the main part. So this ring is going to block the bacterial transpeptidase, but this bacteria came up with a new enzyme that targets that beta-lactam ring. So now you have a target. That's the beta-lactamase. It's the enzyme that breaks up beta-lactam. So now that bacterial transpeptidase can go do its thing. So what it did is create an enzyme that will block it. So those are the 4 different methods that we know of. And there's other ones, but these are the main ones that occur fairly frequently. Okay, so you guys feel pretty comfortable with vaccines. So here's our bacterial vaccines. Let's do those. So here's the pneumococcal, meningococcal, DTaP, and Hib vaccines. Those are all bacterial. What else? Alexander Fleming, we know him. We know penicillium mold. We talked a lot about that. What else do we know? Resistance, we kind of know how that happens. Anything else that you guys want me to go over? Do you want me to go over that again, or yeah, go ahead. I'm sorry, what? Oh yeah, so that was on your book, was the R factor. So what we call that is there's the bacterial chromosome here, and then there's a plasmid, or many plasmids. So if there is any of these things, any defense mechanisms from bacteria on that plasmid, that's what a plasmid is called, an R factor. It's called an R factor.
And that's only for ones that contain the immunity, or
Any of those. If it contains antibiotic resistance, we stress about that. We worry about that a lot.
Is that something we talked about in lecture?
No, it was in the book. So it's really scary, right? Because if they can pass through conjugation, plasmids through conjugation, it's gonna pass that methodology to all the other bacteria around it. So every bacteria within that population is also now antibiotic resistance. It's not like that one bacteria has to survive and reproduce. Now all the bacteria within that area have it, and then if that bacterial infection is passed patient to patient, all those other patients have it. And then the bacteria around them have it. And so it's a really scary thing. Plasmids are terrifying. And now we're trying to come up with pharmaceuticals to target the sex pillars, to target like methods of conjugation so that bacteria can conjugate.
Oh, that's cool.
Yeah, that's great. Yeah, it's really important because it's a huge problem. That's why it passes around so quickly, even within one patient.